Welcome to the Plant Trainers Podcast, where we're helping people improve their quality of life through nutrition and fitness. And now, your hosts, nutrition and wellness coaches, international speakers, Adam and Shoshana Chaim.
Hey, I'm Adam Chaim.
And I'm Shoshana Chaim, and we are
Propelled by Plants. Today we bring to you episode 392, Approaching Breast Cancer Holistically with Dr. Jenn Simmons.
In this episode of the Plant Trainers Podcast, we talk with Dr. Jenn Simmons about breast cancer basics. So it's a really good treat because she's so knowledgeable and no nonsense, and she recounts the story of her own Graves' disease, overcoming COVID, and giving up her successful surgical career to help others with their health in a more natural and holistic manner. You're going to hear about soy and breast exams and mammograms and meditation and all different types of things that affect our lives. So both males and females will find this episode fascinating. We made sure to include the males as well.
Dr. Jenn Simmons is a functional medicine doctor and founder of Real Health MD. She attended Jefferson Medical College, completed a general surgery residency at Albany Medical Center, and was the inaugural fellow in breast disease in Philadelphia. Dr. Simmons was one of the leaders in breast surgery and cancer care in Philadelphia for 16 years. Passionate about the idea of pursuing health rather than treating illness, she's immersed herself in the study of functional medicine and aims to provide a roadmap to those who want to know real health. Dr. Simmons frequently speaks about her health journey and on what she learned in the course of healing herself. She continues to serve her breast cancer population by helping them and others to achieve hormonal health. When Dr. Simmons is not working, you can find her spending time with her family at the dog park with her 3 dogs, pursuing her local farmers market, on the tennis court, or in the kitchen with friends cooking up a storm. Great episode, lots of important information here to share out, so please enjoy the episode.
You've told us that you're bored of what you're cooking. You've told us that you're not eating out as much and you want to be a little bit more entertained with what's on our plate. So we showed up and we made the Plant-Based Comfort Foods Cookbook. It is an e-cookbook that is above and beyond what we've done before. The pictures are gorgeous. The recipes are easy, but they're going to look restaurant quality. We are super excited for this book and we can't wait for you to get your utensils on it. Check out the link in the show notes or check it out at planttrainers.com/shop.
And now for a moment of gratitude.
I'm grateful that we've been watching the Avengers or Marvel series since the beginning of the winter break. We're not quite done, and it allows time for snuggling, more movie time, and lots to talk about within the family.
I'm grateful for the opportunity I've had to share meditation with my fitness class in the high school I teach in, and they've been enjoying it. We've been doing a daily meditation, and I think it's been very cool and helpful for all of us.
Dr. Jenn, thank you so much for joining us on the Plant Trainers Podcast today.
Thank you. I'm so happy to be here. I always like to meet my people.
It's good to meet our people, for sure. It helps us feel grounded. It helps bring us up. It helps the energy going. And I know that the listeners love meeting the people too, because they're just learning that there's more and more people out there who are here to support them, who are here to give them what they need, and that we can all make this work.
Yeah, and help them shine their light.
Exactly. Talking about shining light, what are you grateful for today?
Oh, so we have a lot to celebrate around here, which seems kind of crazy and maybe something that you wouldn't normally celebrate. But my husband had an antibody test over the weekend, and he has antibodies to COVID. So we feel like incredibly free and relieved. We're walking around dancing. We can't get it. We can't give it. Like, we feel like we got a hall pass. So we've really been celebrating that this weekend. We both had COVID. He didn't even know he had it. I was sick for a day and a half, and then went on Facebook with my story and my perspective on COVID, which I will happily share with you if you'd like me to, and I'll happily skip it if you wouldn't. But of course, anytime you say anything about this virus, it's met with very mixed reaction. And so I had to not check my Facebook page for probably a week just because I didn't want to I didn't want to engage in negativity.
And that's huge because a lot of people will put their positive feelings, their positive lifestyle changes, their positive wins out there, and it is met with a lot of negativity, and it does bring people down. I know I was sick for a couple of days and I didn't go get a COVID test, and I'm almost kicking myself that I didn't, because I really want to know if
you can just check antibodies.
I could, or I could stay home. I could stay home right now as we're recording. We're on winter break with the kids, and I'm like, oh, am I going to put myself at more risk by going there to get it checked, or just, yeah.
So for us, it wasn't about staying home, because we're staying home anyway, but we're the entertainers. Mm-hmm. We're the home that everyone comes to. And most importantly, my parents wouldn't see us. Mm-hmm. They're part of our infrastructure. And so when my parents wouldn't come see us, I both worried that they were alone in their apartment, not getting enough interaction. But also, I think that one of the very, very sad parts of our current society is that we stopped being multi-generational. Mm-hmm. And though my parents are far from perfect, they do have 20 to 30 years of wisdom beyond mine. And so that means something, and it means a lot. And I think it's really important for children to grow up in as much as they can with multi-generational influence and wisdom and exposure and experience and that kind of thing. And so when my parents wouldn't come here because they were afraid, it became a tremendous relief for us to know that we had antibodies. That part of our story is over, at least for now, and that people can come to us without hesitation or reservation.
That would be nice to be able to socialize again. I mean, we
haven't seen them in months and months and months.
His mother and my parents, they live in Montreal, and of course we're in Toronto. So, I mean, we haven't seen them since August. Mm. And before that, we hadn't seen our parents since over a year ago. So I've seen my parents once in a year. It'd be nice to hop in the car and drive there now and see them. So you do have a point. We should look into if that's even an option up here yet, an antibody test, and if they're doing that. But you can go ahead and share that story now if you'd like. Is there more to the story?
I mean, there is, in that I have felt from the beginning, and I don't know what the culture is in Canada, but in the United States, it's very much live however you want to live, get sick, take a pill, manage the symptoms, go on to the next illness, take a pill, manage the symptoms. And so they haven't treated this any differently. So it's all the talk is about the vaccine. All the talk is about the vaccine or coming up with some wonder drug that will treat this. But the truth is that COVID is simply a sign of the health of our society, because in a healthy vessel, this has almost no implications. And it's because we are so unhealthy. I think Mark Hyman quotes the statistic that 84% of Americans are metabolically abnormal. And so it's that pre-primed inflammatory state that has such a marked impact on people when they encounter this virus. So when I got sick, I used all the tools in my toolbox that I knew to use. So I fasted, because when you need to heal, then you want to rest the GI tract. So I didn't force myself to eat. And when I ate vegetable soup, which is very nutrient rich. But I waited to be hungry to do that. And I also took very high doses of vitamin D, because I know that that your vitamin D level almost predicts what your outcome is going to be with COVID. So I bumped up my vitamin D, I bumped up my vitamin C, I bumped up my quercetin, I bumped up my glutathione. I made sure that I was getting zinc, because zinc prevents viral replication. And then once I recovered, I published this whole protocol. And I said, we need to take the focus away from treatment. We need to take the focus away from the vaccine. And we need to focus on getting healthier. We need to focus on doing the things that drive health every day. And if you get sick, it's not going to be meaningful. If you get the virus, it's not going to be meaningful because you're healthy. And most of us are not. And when I hear stories about people that, allegedly had no health problems and they got very sick from COVID, my response is they probably didn't know that they had health problems, but they're almost certainly there, not the least of which the vast majority of us walk around vitamin D deficient because your climate is just like my climate, and there's no way you're getting adequate levels of sunshine and no way you're manufacturing adequate levels of vitamin D.
Dr. Jenn, we get people coming to us, whether they're athletes or whether they want to transition their families to plant-based diet. So we get our clients coming to us telling us that they're healthy. And then you start to ask questions and you realize that they're on anti-inflammatory medications or they're taking drugs to manage their cholesterol or their blood pressure. But because they're not experiencing symptoms in this point of time, they consider themselves healthy because they're going through day-to-day feeling all right. But then when you start to uncover people's idea of what healthy is if they're being managed by medications and they're not experiencing more symptoms, then they're healthy. They don't see that there's that unhealthiness under that layer of onion too.
I don't think it's much different in Canada than the US. We always hear, the doctors here are always treating symptoms, not the underlying cause. And with this whole COVID situation, all we've been hearing from the government and the doctors is we need to wear a mask and we need to stay 6 feet apart. And we're not talking about the food that we're putting in our body and taking care of ourselves from the inside out. We're talking about the vaccine, and it's not much different where you are. So it's very frustrating that people are not taking care of themselves. Rather, they're just putting a Band-Aid on it, so to speak. And I don't know how that's going to change or if that's ever going to change or what we could do about it. But it's a very frustrating situation.
But it's no different than the rest of the illnesses out there, really. It's following the same trend.
It's so horrible. It's this whole damsel in distress scenario where you're waiting for the white knight to come save you. And everyone has given away their power. Everyone forgot that they can save themselves. But that takes hard work.
It does take hard work. And at the same time, I don't necessarily point a finger at those people because 10 years ago, I could remember being in that place before we found a plant-based diet, before we understood more about health, before we understood about wellness as opposed to sickness, right? We have a very different understanding, and not everybody has been exposed to it, or not everybody has welcomed it yet. They haven't had enough exposures to it yet. Why don't you tell us a little bit?
I think this next generation is far more savvy. I think this next generation is saying, wait a minute. Why should I take a pill to cover up a symptom? What's causing it? I think that this next generation is really asking the why.
Millennials don't want to pay for the medication. They just want to travel. That's why. How can I stay healthy as possible to use my money where I want to?
Yeah, maybe. But you know what? From my perspective, I'm all good with that. If that's what it's going to take to get us healthier, a different distribution of money, guess what? There should be a different distribution of money. Why are we paying hundreds of millions of dollars to bring another drug to the market that's going to help a minuscule number of people? It's ridiculous.
Well, there's 100 other places where I can go with this conversation, but I'm going to pull it back to the plant-based talk, and I'm going to ask, where did you find plant-based in your life? When did this come to you?
So amazingly enough, and I'm a little older than you guys are, when I was 11 years old at summer camp, my grandmother came to visiting day, and she brought an article with her. And she gave it to me to read, and I don't even remember like now what the study was, but whatever the study was, it associated being a vegetarian. That's what it was called at the time. We didn't talk about plant-based then, but being a vegetarian and having less heart disease. And my grandfather had died of heart disease. He had had 9 heart attacks before he finally had a stroke and died. Mm-hmm. So he was kind of like sickly for all of my childhood. And my grandmother said to me, read this article. It's too late for me. I can't stop eating meat now, but you're young enough, you can. And for whatever the reason, and I'm going to say like maybe a little bit of divine intervention, I did. Like, why would an 11-year-old suddenly become a vegetarian? But I did. And then I briefly, I guess in my 20s, something happened. Like I started to incorporate meat again into my life. Not a lot, but some. And when I married my husband, definitely more, because he is like a super carnivore. And then whether it was the stress of my job, whether it was whatever the elements were that came together, in 2015, I was diagnosed with Graves' disease. And do you guys know what that is?
Yes, we've done a podcast on it, and we could link to that in the show notes. But why don't you, for those people that don't remember, why don't you give a little overview?
Yeah. So Graves' disease is an autoimmune disease of your thyroid gland, where your immune system and your immune cells think that your thyroid gland is some foreign invader, attacks it. And what happens then is that your system gets flooded with thyroid hormone. So this is a very, very dangerous form of thyroid disease. It's actually the only benign thyroid disease that will kill you. So it's life-threatening, and it's like immediately life-threatening. So I went to see my doctor, and at this time I was a breast surgeon. I was operating on cancer patients every single day and treating cancer patients, hundreds a year for breast cancer. And I was given the option of surgery followed by radiation and then taking lifelong suppressive medication. And even though those were the things that I recommended to my patients every single day, to me, I was like, no, there has to be something else. There has to be something different. And it was really the first time where I was introspective in this way, in that I said to myself, like, why would God give me an organ that I need and then make it dysfunction so that it should be removed? And for some reason, I didn't associate that with the breast. I think because the breast is like needed in a limited capacity, but you don't need it for everyday life. Whereas your thyroid gland, like you can't get through a day without it. So I refused treatment, which you can imagine how that was met by my colleagues. And I went on a journey to figure out how to heal myself. And every single thing that I read talked about plant-based, 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 plant-based. And I said, there has to be something here. And I called my endocrinologist, who was also a friend, and I said, I'm going to give a vegan diet a try and see how I do. And he said, it won't work. It's very dangerous. It's not what I recommend. And I said, I just have to try this. I have to do what instinctually feels right to me. And that was it. And it took 3 years. It's not a quick fix, but given what it needs, your body will heal itself. And I know that. And so it may not heal itself in a day, a week, a month. And I know that you have your own journey, and you know that it doesn't heal itself in a day, a week, or a month. But in 3 years, I had no signs of thyroid disease.
So that is absolutely incredible. And the part that is getting in my head, and I'm sure a lot of the listeners, is you had to wait those 3 years. So what signs did you have over the 3 years to let you know that it was okay to keep going with this and that you did not need to rely on the other protocols in the meantime?
Yeah. So to be fair, I did take a beta blocker, which is something that slows down your heart rate, because I was having near constant palpitations and I was afraid that I was going to have a heart attack in the interim. So I did take a beta blocker, but only for a month. And then what I did was I just monitored my symptoms. And, there were other things that I started to do too. So I started a breathing practice. And whenever I would feel those palpitations come on, I would kind of stop what I was doing and I would go do my breathing. And so besides food, what I didn't do and what probably would have sped up my timetable is I didn't learn enough about stress management techniques, and I didn't stop working 12-hour days. And had I done that, I'm sure that I would have healed quicker. And, hindsight is 20/20, and I have a lot more wisdom than I had in 2015. And I actually have changed my career since 2015. I mean, I went from there to the Institute of Functional Medicine, spent 2 years, studying there, going through their programming. And in the summer of 2019, I actually left surgery at the top of my game, in the very crest of my career. And I walked away like cold, went from being a full-time surgeon to being a full-time functional medicine doctor. For me, that was the only way that I could do it. I couldn't make a transition out. I had to make room and space in my life for this next chapter. And, I'm a different person. I barely recognize that person.
It's amazing to be able to make a change and gain your health back and then change your career and do all these amazing things. I think it's really important that we should say that anyone listening to this amazing story shouldn't just go and become vegan and heal themselves without knowing a little bit more of what you went through and without the care of their doctor and all of those.
Absolutely. Although, unfortunately, I find that most doctors don't really know much about being a vegan. And I also want to say that there are lots of junk food vegans out there. And so when I talk about being a vegan, I want to be clear that I am talking that I eat plants, whole plants, not processed food. I'm also grain-free. So I'm really just eating super duper high quality vegetables.
And I was going to ask before, was it vegan or was it more plant-based where it's, non-processed? What about sugar and what about fruit?
So my feeling about fruit is that you need to treat it like candy. And yes, it does have some vitamins in it. And yes, it does have some fiber, but it also has a lot of sugar. And sugar does cause a lot of inflammation. And the sugar in fruit, the fructose, is still toxic. So it does still have ill effects on your vital organs. And so I treat fruit the way I treat candy, something special. And I also am fairly particular about being seasonal. Mm-hmm. So during the winter, I'm almost never eating fruit unless, we go on vacation or something like that, and it's an exception. And during the summer, if I go to the farmer's market and they have beautiful berries on a Saturday, I'll buy a basket of berries and we'll eat them, and then, that's it. But I'm not a big believer in fruit, but that works for me. And that doesn't mean that no one should eat fruit. That doesn't mean that that's what works for you. And I think that there's a lot of intuition that needs to happen so that you get to your place and whatever that place allows. Now, I don't eat any grains. And I also, for the most part, recommend that most people don't eat a lot of grains for the reasons of grains are the seeds of grass, and we are not ruminators. Our digestive tracts are not really designed to process grains. But for some people, grains are fine. And it takes a lot of experimentation to figure out what the right thing for you is. I just know that being a whole food, non-grain, non-sugar eating vegan is what my body needs. That's how I feel the best.
Hi everyone, I'm Camille Labchuk, one of Canada's leading animal rights lawyers and the Executive Director of Animal Justice.
And I'm Peter Sankoff, author, blogger, lawyer, and criminal law and animal law professor at the University of Alberta.
Together, we host the Paw Order Podcast, Canada's only animal law podcast brought to you by Animal Justice.
We put out new episodes every 2 weeks, bringing you in-depth analysis of animal law issues in a way you don't need to be a lawyer to understand.
We feature some incredibly interesting guests, and we bring you all the latest animal law news from around the globe.
So please listen to Paw and Order on your favorite podcatcher.
Thanks for listening, and now back to the show.
And I'm glad that you pointed that out, because different people are going through different health issues. Some people are not going through health issues. Some people will soak their grains before they eat them, and that helps them. So everybody kind of needs to look in, and a lot of people will say, can I eat this or can I eat that? It's a more than a yes or no. It's a who are you? What's going on in your body? Maybe you can't eat it now, but maybe you'll be able to eat it in 3 years after you have some massive digestion
overhaul.
Oh yeah, your overall digestion heals. I mean, our son was allergic to wheat and gluten and can tolerate it now and has been eating a ton of it. And we've kind of noticed a little bit of symptoms coming back out again. So he's backing off for a month. We're doing no gluten whatsoever. And then after that, we'll put more gluten in, just no wheat, and we'll kind of see what happens. And, it's a process, and we need to pay close attention and decide what's more important for us, the food that we eat, because we could always find other good food, but the food that we eat, or our overall health and how we want to feel. And some people will choose the former, some people will choose the latter, and that needs to be their decision.
Yeah. And it may not be something that is like all the time, right? So maybe you know that you have a problem with dairy, but maybe once in a while you're willing to accept that because you really want to have an ice cream with your kids or something like that. And only you can decide that, right? But I do encourage people to find those answers for themselves. And there are lots of ways to do it. I mean, you can eat a food and see if your heart rate goes up. And if your heart rate goes up, that's probably your body telling you, this isn't great for me. And there are lots of ways to figure that out, but you have to be intuitive about it.
Definitely. And I'm sure that that's something that you're talking to your patients about now, being in functional medicine, but wasn't necessarily so when you were, Philadelphia's top breast surgeon.
Yeah.
Let's talk about breast cancer for a couple of minutes. And I don't know if it's something that I hear about almost daily. Somebody else has it. Somebody else had it. It's running in their family so much more than when I was younger. I don't know if it's that I wasn't exposed to it, but it really does seem as if the numbers are going up. What do you think the cause of that is?
Food. We are not growing up on our mother's earth or our grandmother's earth. We're growing up on a very different earth. We are surrounded by chemicals, and a lot of those chemicals are being put on our food, added to our food, that kind of thing. And the vast majority of them are acting like toxic estrogen in our bodies. So the reason that we are seeing this rise in breast cancer, and it's real, and it's actually going to get worse with COVID because, the poison is in the dose. And so that we have all the toxins that we had before in our food, in our water, in our air. And now stress is also a toxin, because depending on your ability to manage that stress, it will get converted into your body as cortisol, as our stress hormone. So the added stressor of this virus is going to increase those diagnoses, because it's going to take people over their toxic load, over their ability to clear it. And the breast happens to be a fairly sensitive organ in terms of cancer development as a result of toxic burden.
So then what do you recommend people do other than eat a plant-based diet and reduce their stress?
Well, it's not a matter of reducing your stress, right? Because this you can't get rid of it. It's there. I mean,
or the way you react to it.
Yes. That's what you need to do. What you need to do is figure out what your tool is going to be. And everyone's tool is different. So, I learned to meditate. I learned to do deep breathing. And so, that's my tool. But different people have different tools, and you need to figure out what's going to work for you, what is going to allow you to give different meaning to those stressors, because it's the meaning that we give to it that's important, right? And your ability to say, thank you for sharing. I'm good. You can go. That is what is going to either determine your health or your lack of health. So that part, you have to figure out what is going to be right for you. I'm sorry, there's a lot of screaming in my house.
That's okay.
We have a lot of men that are listening to the show, and they're probably thinking, oh, okay, we're talking about breast cancer now. It doesn't affect men at all, but does it?
But we're not really just talking about breast cancer, because at the root of breast cancer, but at the root of all chronic illness is inflammation. And so you're either going to take that stressor and turn it to inflammation, or you're going to take that stressor and just get rid of it, dismiss it. I have no use for you. So for the men that are listening, no, maybe they're not getting breast cancer, although they are, and they are at increasing rates. So it used to be 1 in every 1,000, but that is going up because of the amount of xenoestrogens, or those chemical estrogens in our environment. But beyond that, so if they're not getting breast cancer, they're getting prostate cancer, or they're getting heart disease, or they're getting autoimmune disease, which we're seeing more and more and more in men. So it's the inflammation that matters. Everyone's going to manifest that inflammation differently. So for everyone, the breast cancer population is no different than the prostate cancer population, which is no different than the colon cancer population, which is no different than the coronary artery disease or heart disease population. It is all about living that anti-inflammatory life. It is all about making sure that your toxic load is diminished as much as it can be, so that you don't go on to manifest these diseases. We think that all these are the same. Oh, breast cancer is the same, prostate cancer is the same. Nothing's the same. The only thing that's the same is that we're all manifesting inflammation. The key to all of this really is to live as anti-inflammatory life as you can. And so it's doing things like mindfulness and stress reduction, but it's also making sure that you're getting adequate and nourishing sleep, and having a movement routine that brings you joy, and detoxifying your environment in as much as you can, and doing these detoxification procedures so that you can decrease your toxic load. But it's also about having really meaningful social connections and having a purpose-driven life.
All of those things. And it's funny because you've mentioned estrogen, and you've mentioned inflammation, and you've mentioned detoxifying, and not just, the products in your house, but also the people in your life who would be bringing that on too, having those good positive connections, like you said. And I'm sure when you said estrogen, people were saying, okay, I'm waiting for soy. I'm waiting for her to mention soy. So where does that fit in how you're counseling your patients now?
So I want to be clear that the populations around the globe that eat the most soy have the lowest rates of breast and prostate cancer. Okay, so let's start with that. The problem with soy, especially in the United States, and again, like I'm not familiar enough with the farming practices in Canada to speak to this or where your sources are, but the soy in the United States is highly adulterated. So first of all, most of it is GMO soy. So when you take something and you modify it, our bodies no longer recognize it as food. They see it as a foreign substance, and we have an immune response to it. Now, taking that out of the equation, let's say that we're talking about non-GMO soy in its original form, so eating edamame. I believe in eating edamame. And there are minimally processed forms of soy like soy milk and tofu and tempeh. And these foods, I think, are a very safe, important part of your diet if you tolerate soy, which some people don't tolerate soy. And, the way to know that is, again, you can eat one of these things and take your pulse and see if your heart rate goes up more than 10 beats. It's probably not a great food for you. But for the people that can get quality soy and that they tolerate soy, I think soy is an outstanding part of your diet. Now, what I don't like are all the highly processed soy things. So once we get into those highly processed situations, your body no longer recognizes that as food. So I'm not eating any of those Impossible burgers and, whatever those soy isolate things. I just don't, I don't do that, but I don't do any processed food, and I don't encourage any processed food. And I know it happens, and I just tell my patients to not tell me about that.
Or that's your candy. It's your sometimes. Right. It's your going to a restaurant and it's on the menu and it's the easy option. Exactly. I don't know if this is happening in the States or what your procedures are, but when I went for my last physical with my doctor was during COVID. So it wasn't even supposed to be a physical, but I was due for some other tests. So I went in and I said, not that I'm asking for it, but no breast exam today. And she said that COVID aside, they are saying that most people who are finding lumps in their breasts are finding it on their own. And that the one or two that she's found over the years has, yes, maybe saved lives. Maybe they would have found it on their own, but she's not normally the one who finds it. It's normally people who are finding it on their own. So I guess to save time or what have you, it's not recommended that GPs are giving breast exams anymore, and it's up to us to do it on their own. So I was wondering, is it the same in the States, and how do you feel about that?
I don't even know if the primaries in the States are examining the breasts, but what I do know is that most of them are not trained to examine the breasts, so they don't necessarily do a good job of it anyway. I have my own very personal feelings about breast examinations. I think that it is horrible that we have discouraged women from doing breast examinations and said that it doesn't matter, because you tell that to the 30-year-old whose life was saved because she found her lump. So I believe very much in breast examinations, but I think they should be self-examinations. So, whether or not those primaries are doing the job, I don't think that matters so much, but they should for sure be talking about it.
Right, and reminding you to do that. And when she told me is, make sure you're not doing it every day. Because if you do it every day and it's growing that 1/3 of a millimeter every day, you're not going to see it sneak up on you, because it's just going to seem so normal. But if you go back once a month or once every 2 months, if there's been a big change, then you'll be able to feel that change.
I do agree that you shouldn't be examining yourself every day, but once a month, you should be doing a real good look where you're looking in the mirror and you have your arms down by their side and then up over your head to look for any skin changes, dimpling, anything like that. But then a breast exam should actually be done lying down. And the way that most people do it with like a kneading motion is not the right way to do it. You want to go around and with light touch and just do a radial exam all around.
So like padding for the people who can't see.
Not padding, but running your hands around like this.
Right. Got it.
I don't know.
Yeah. So pulling down as opposed to going in circles.
Yes. Pulling down as opposed to going in circles and just going around the clock.
Around the clock. Good.
Yeah.
Thank you. And the other
side towards the nipple.
And anybody who wants to kind of see how you signed that to us, they can go onto the YouTube at Plant Trainers too and see that over there. Most of our listeners are listeners as opposed to watchers. And then the last question I had about breast cancer for you today is, what about mammograms? Dr. Greger talks a lot about mammograms, and I think the numbers were that mammograms were saving maybe 1 in 1,000 lives, but it was destroying so many others for people who have found things that never would have become a full-blown cancer and the body would have been able to take care of on its own.
Yeah, so I'm not sure how I feel about that statement, and I love him, and I think that he is absolutely brilliant, okay? But the thing is, my opinion about a breast cancer diagnosis, it's never a blessing, but it is an opportunity. So for the people that develop breast cancer, they're developing breast cancer. This is a normal adaptation to an abnormal environment. So their chemistry has changed, the environment has changed, and these cells are just trying to survive. That's all they're doing. So without getting that breast cancer diagnosis, what's going to change? So, we assume that many of these wouldn't become clinically relevant, but I don't know that to be true. And I don't know how we could know that to be true because we don't have a subset of people who we diagnose and don't treat, right? Everyone who gets a diagnosis gets treated, nearly. And if they don't get treated, our current medical environment doesn't know what to tell them to do in lieu of having surgery and chemo and radiation. They're not trained to tell them, okay, if you don't want to have surgery and chemotherapy and radiation, then you need to adopt a whole food plant-based diet, start a joyful movement routine, start a mindfulness practice and a gratitude practice so that the overarching feeling in your body is that of joy and not of stress and aggravation and anger and whatever else. And clean up your environment so that the toxins going in are far, far, far less and allow your body to detoxify what's already there. And take a look at your social connections, your relationships, figure out what works for you, figure out what doesn't, and get rid of the ones that don't. Right? I mean, that's a really important part of the work. And then what do you have that you're living for? What's your life's purpose? And really focus on that because that's what really drives us. I mean, the number one thing that predicts how long any of us will live is the strength of our social connections. And so, outside of that, I think that what mammogram is doing is it's giving people an opportunity to make a change. Because if you just keep doing the same thing, that's the definition of insanity, is doing the same thing and expecting a different outcome. So for me, I don't know that I would take mammogram away because that's my captive moment. That's when I get that person and say, is this really the path that you want to continue on? Or do you want to change your journey?
I think all those questions are so incredibly important, and it's the time right now we're in the new year, right? So it's a perfect time for people to answer those questions for themselves without actually waiting for some type of illness to show up or present themselves in their body. So thank you for sharing that. And that's a lot of what you do with your functional medicine with your patients. And I wanted to give you a second to share a little bit about your practice and let people know where they can reach out to you if they're interested.
Yeah. So though my practice, which is called Real Health MD, is primarily geared towards helping women who are affected with breast cancer in any way, whether they're pre-vivers and worried about the development of the disease because they have a mutation or because they have a strong family history, or they've been recently diagnosed, they're going through treatment, they have been treated and now are wondering now what, or they're living with metastatic disease. My focus is driving health in that population so that they can heal. And no matter where you are on that journey, you can heal. And I'm very, very clear that my message is one of hope. And for the people that don't believe, that means you're not ready to work with me yet, because I believe that everyone can heal. And while breast cancer makes up the majority of my patient population, breast cancer almost never travels alone. Breast cancer often has lots of companions, and so I help people with the companions to breast cancer, with the weight issues, with depression, anxiety, with autoimmune disease, with heart disease, with lipid disease, all those things, because again, breast cancer rarely travels alone. So I'm helping with all of those things.
And if people would like your help or would like to learn more about where they can reach you, where would you like them to go?
Yeah, you can just go to my website at realhealthmd.com. And if you want to jump on a discovery call with me, if you think it makes sense for us to talk, to see if there is something that I can do to help you heal and to help you improve your health, if you just go under the Start Here tab, you can just schedule a discovery call with me.
Great. So we will link to that at planttrainers.com in the show notes. And we'll also link to your Instagram too. You're pretty active on Instagram as well.
I am. Yeah. Thank you. And people can learn a lot just from following my Instagram every day. I mean, I'm really trying to put the information out there, to get the information out there, because to me, if you're getting healthy on your own, that is awesome. And nothing delights me more.
Yeah, Dr. Jenn, thank you so much for all this incredible information. It's really, you're helping so many people, and you continue to do so with all the work you're doing. So we really appreciate that, and we appreciate you being here and connecting with us on the Plant Trainers podcast. So thank you.
Thank you. And thank you guys for having me. I'm so delighted to have this connection.
Thank you all so much for listening to this edition of the Plant Trainers podcast. We want to make sure that you subscribe on iTunes, Google Play, iHeartRadio, Stitcher, or any other podcasting platform.
We really appreciate the feedback we receive from you. Every time we get a 5-star rating or review on iTunes from one of our fans, it really helps other people find us just like you did.
Thanks so much to our patrons. To become a patron, visit us at patreon.com/planttrainers. Even supporting us with $1 really makes a difference in the quality of the show.
And don't forget to connect with us on Instagram and Twitter. Our handle is @PlantTrainers. Like Plant Trainers on Facebook, join our newsletter, and check out our website at planttrainers.com for awesome recipes, a list of our services, and of course, our latest podcast.
We encourage you to email your questions to info@planttrainers.com so that we can help you improve your quality of life through nutrition and fitness.
So we hope we've inspired you today. Join us again next time and have a healthy day. Or is that too corny?
It's a little cheesy.